We've talked before about the fact that some places in the face to inject filler are safe, whereas others are considered high risk. And Molly did a great piece on that. You can look back on her feed and listen to her talk about high risk areas to inject filler. One of those areas that is sometimes considered high risk can be the temple. There are some parts of the temple we know are much safer than others. But I want to show you something that happened today, because every time I inject the temple, if I'm injecting down deep, which is the standard way to do it, I use ultrasound to look and make sure there's no blood vessels, even if they're not supposed to be there. And as I was getting ready to inject someone today, I looked with ultrasound just to make sure, because I knew I was in a safe place. Lo and behold, if you look at this image, you can see right against the bone where I was about to put a needle in a place that's considered to be very safe, there's a great big blood vessel living. That was one you really want to avoid. Suppose I had injected without checking with ultrasound first, and my needle had gone into that blood vessel and I injected filler. That blood vessel connects directly with some other very important blood vessels, one of which supplies blood to the eye and could have led to blindness, which is permanent and not reversible. So this shows that using ultrasound, we can make injections as safe as possible and avoid problems even in areas that are known to be safe.